branched chain amino acid, if you drink whey milk, raw milk, you can prevent cancer. Okay? Colonic premalignancy is associated with hyperlipidemia and hyperinsulinemia. BCAA therefore may be useful chemoprevention modality for colon cancer in obese people. Dietary BCAA intervention could promote cognitive improvement, so improves your memory by restoring hippocampal function after a traumatic brain injury. So ito yung mga na-stroke para bumalik ang thinking process mo. Proceeding from the National Academy of Science, December 2009. BCAA could improve the dendritic cells function in cirrhotic patients. Okay? If you have cirrhosis, okay, or liver cirrhosis, the dendritic cells are involved in fighting diseases. Okay? That is in Journal Immunology 2007. BCAA, leucine, isoleucine, baleen, particular leucine are important factors in tissue growth and repair. BCAA have anabolic effects on protein metabolism by increasing the rate of protein synthesis and decreasing the rate of protein degradation in resting human muscle. Also, during recovery from endurance exercise, branched chain amino acids were found to promote muscle recovery and reduces muscle soreness. A study found that decrease in branched chain amino acids, an increase in tyrosine and the BCAA tyrosine ratio in several parallel the severity of hepatic parenchymal damage. That means high protein in your food will help you solve your problem in the kidney, including liver cirrhosis, right? But this, okay. Remember, branched chain amino acid from raw milk, egg, and red milk. Promotes glucose uptake and is useful for prevention of progressive hepatic failure, and can improve nutritional status and decrease frequency of complications in patients with liver disease. Okay? That is from Gastroenterology Journal, Liver and Shelby, 2005. BCAA successfully decreased the severity of the anorexia, loss of appetite in cancer patients. That is Cancer Journal, okay? 1996. And patients with chronic renal failure have a decreased level of BCAA food, especially baleen, causing protein wasting and altered brain function. In dialysis patients, oral BCAA supplementation induces an improvement in appetite and nutritional status, thus able to retard the progression of renal failure. Even for my kidney patients, I give a lot of milk, a lot of egg, and they improve very fast. Okay? Bioactive peptides. This is what I discussed earlier. Bioactive peptides, they are what? They are good for ACE inhibition. They lower blood pressure. They are found where? From casein, lactoferrin, and alpha-lactoglobulin. They are found in whey and raw milk. The bioactive peptides lowers blood pressure, ACE inhibition, antimicrobial activity, quercetin, lactoferrin, and they can fight bacteria, virus, anti-tumor property, casoplatins. They can fight cancer, okay? Antiviral activity against hepatitis, HIV, bird flu, herpes. These are bioactive peptides. Antioxidant stress, antioxidant, like vitamin E, vitamin C, anti-diarrhea and irritable colon, that is from the Journal Immunology 2000, immunomodulation, but all of these bioactive peptides are destroyed by pasteurization. Alright? So we are missing a lot because of pasteurization. Another one from the bone marrow. The bone marrow. In Tagalog, that is bulalo. Okay. By the way, Don Manolo has a programs at DCBB. Every Saturday at around 10 p.m. we will hear my patients giving testimony. That is DCBB. Pero pagdating ng Sunday, ang nagsasalita si John Kitts, siya ang guest, kumakanta siya. Okay? John Kitts siya makinig 10 p.m. DCBB. At pag Monday, ako po magbibigay ng lecture about, ang topic ko ito rin, cholesterol. Okay? DCBB. So huwag niyong kalimutan yan. Ang tawag po sa akin doon, Dr. Bulalo. Okay. Pero ngayon, in English na. You know Big Moro, right? Big Moro. You have heard about Big Moro, right? Very good sa combat. Ngayon, ang tawag sa akin, Doctor, hindi na Dr. Pulalo, Dr. Bonnie Maro. Okay, let's proceed. Endothelial progenitor cell is a stem cell. A stem cell. That's introduction on there, no? It's a promising treatment for ischemic heart disease. Very good, right? That's Journal 2009, American Annals of Thoracic Surgery. Endothelial progenitor cell can be a novel treatment option for complications requiring therapeutic revascularization and vascular repair, especially to patients with diabetic complications, those with rheumatoid arthritis. So it's very important so that you can vascularize the areas that needs to be like ischemic heart area. Endothelial progenitor cells protect kidneys from acute ischemic damage. So you see, bone marrow is excellent for kidney patients. Okay. Neurovascular dysfunction and senescent endothelium contribute to the progression of Alzheimer's disease. Circulating angiogenic cells, okay, such as EPC, endothelial progenitor cells, provide a cellular reservoir for endothelial replacement. Results indicate that patients with Alzheimer's disease have reduced circulating angiogenic cells, and increasing the EPC levels of Alzheimer's disease patients will result to better prognosis. Okay, so how would you understand? That's a Journal Virology 2009. If you have a blood vessel, the endothelium is the interior of the blood vessel. Okay? If the endothelium is senior citizen, it's already crack na. It's just like an earthquake, nagkaroon ng crack ng wall. So doon sa crack, platelets will flow, and when they hit the crack, they will clamp and cause clogging. The endothelial progenitor cells will revitalize the interior, the intima, and remove all the crack. So, ang mangyayari, what will happen is that your senior citizen endothelium will become junior citizen endothelium. So, pakinggan mo maya sa stem cell enhancing effect yan. Okay? Mamaya hapon, anong oras na ba natin? Hindi naman ako nagumutom po. Huwag kayo mag-alala sa akin. Baka kayo ang gutom. Pwede pa kayong kumain din. Okay. Cholinergic neuron, bone marrow stromal cells. All of these are stem cells na. Okay? Pero introduction ito, hindi po itong topic ko sa stems. Bone marrow stem cells, stromal cells. Cholinergic neurons are very important cells in spinal cord injuries because of the deficits in motor, autonomic, and sensory neurons. In this study, bone marrow stromal cells as a source of cholinergic neurons in a rat model of contusive spinal cord injury were evaluated. Result: transdifferentiation of BMSC into a cholinergic phenotype is a feasible therapy in spinal cord injury. So that's 2009. Cytotherapy, stem cell therapy. Now, what happened? You know, the bone marrow stem cells, they become hematopoietic stem cell, red blood cell, white blood cell platelets. And also, the fate is mesenchymal stem cells that become small muscles, connective tissue, tendons, and bones. But in special circumstances, under my system of stem cell enhancing, the bone marrow stem cell can become neurons that will repair brain damage, liver, brain damage. Yes, my patient, as I was telling you, a nurse, she had a stroke and she could hardly walk. And she had been to doctors and nothing happened. And somebody told her, you better go to Dr. Navarro, your condition will improve dramatically as if you had only a cold, right? Yes. She took the medicines. Within 3 days, she was almost blind. She could not see. She had to walk like that. She's a nurse. She's from Quezon City General Hospital. Within 3 days, everything is perfect. Already 1 year, I saw her. Okay, mamaya konti, may magbibigay ng testimony. Okay. So, that's how fast stem cell enhancing work. Pero, hindi pa tayo natapos. Okay, mag-alas, I told you, this is already a 1-year course. Salamat kayo. Ginawang half 1 day lang. You see, the transdifferentiation. Normally, bone marrow stromal cells, they are mesenchymal cells. they can only become they can only become cartilage, bone, connective tissue. But in special circumstances, by stem cell enhancing, they can transdifferentiate into neuronal cells to repair damage the brain and spinal cord. Okay? Alkylglycerol also from bulalo, bone marrow, from spleen, from breast milk and raw milk. Very, very high. Improve, boost immunity. Breast milk has 10 times more 8 kg than cow's milk. And it will inhibit cancer proliferation and prevent radiation sickness. So it's very important, right? Alkylglycerol, you get that from raw milk. Okay, and the best source is breast milk. Directly interferes with cancer cell signaling, which is crucial to tumor growth and metastasis. So in the presence of 8 kg, cancer will stop growing, stop metastasizing. I'd like to welcome my son. Isa po siya sa gumawa nito, si Dr. John Navarro. Ask mo dan siya nakita ito. Ako po ay back up ng pamilya ko. I thank God for that. Okay, that is Anti-Cancer Research 2003. Alkylglycerol from bone marrow, spleen, breast milk, and raw milk, and breast milk. Okay? AKT inhibit activation of protein kinase C, which is essential for the runaway cell proliferation that is a hallmark of cancer. You can see how powerful is AKT. AKT is able to regress tumor even before radiation treatment began, a finding that was soon replicated by others. Okay? That is Acta Obstetrical Gynecological Scandinavia in 1978. AKT stimulates white blood cells called neutrophils and activates macrophages. What will they do? They will kill cancer cells. They will kill bacteria. So that is AKT. So when you get breast milk has 10 times more AKT. So that's why if you have cancer, you better find breast. Breast milk costs 500 pesos per liter kung order ka. Pero wala po tayong available sa Amerika po yun. In the Philippines, nobody sells breast milk. Sa San Lazaro po lang may breast milk. Baka subukan nyo, okay? Okay, mag-aalala. Magtatayo na ako ng breastfeeding sa clinic. Joke lang yan. AKT is also a powerful vasodilator, able to cause an important arterial hypotension. Kita niyo ba yun? So, bone marrow po lang. Okay, milk, raw milk, they are very good vasodilator. Okay? An important arterial hypotension increases vascular permeability and movement of liquid out of the vasculature. And it is also a chelator of what? Mercury in them. So it's a clean agent, like Edka. AKT is meant to help against colds, flu, chronic infections, asthma, psoriasis, arthritis, and AIDS. So ang dami palang nagagawa ng AKT, okay? Including psoriasis. Okay. That's why mga psoriasis patients, they improve dramatically. Yung iba, refer pa sa akin ng mga dermatologists, okay? Lysozyme in egg white, okay? It should be raw egg for this to be effective. Lysozyme, an enzyme found in egg white, kills certain bacteria by destroying bacterial cell walls, the rigid outer shell that provides a protective coating. It was discovered in 1922 by Alexander Fleming during the search for antibiotics that eventually led to penicillin. You know, the bacteria, they are coated with coat a wall that will prevent antibody from penetrating them, including cancer. But that can be destroyed by lysozyme. Okay. Kahn and colleagues found that lysozyme in egg white was very effective in killing anthrax spore, andulant disease, right? Lysozyme also showed some activity in killing anthrax spores added to ground wheat and milk, and it is also effective in killing cancer. That's why for cancer patients, I recommend raw egg. Why raw egg? Egg white has lysozyme, and egg yolk, if it is raw, has cysteine amino acid. Egg yolk has very high cysteine amino acid. Its capacity to convert into glutathione is 100, perfect. Whey milk is also 100 on score. also very high in cysteine amino acid. So, as glutathione is a good detoxifying agent and anti-cancer. That's from Chemical Society, okay, 2000. Choline, okay. Where do you find choline? You find them in egg, again, brain, livers, brewer yeast, with germ. It is an essential component of acetylcholine. Okay, acetylcholine is a physiologic antagonist of adrenaline. If you are stressed, your heart will increase, your blood pressure will increase. Acetylcholine will antagonize that. Okay, where do you get acetylcholine? You get that from choline, this food. And number one is liver, followed by egg, then brain, and also found in brewer's yeast and wheat germ. Prevents birth defects. Infants from mothers whose diets were deficient in choline were 4 times more likely to have neural tube defects, such as spina bifida. Okay, that is American Journal of Epidemiology, 2004. Neural tube gives rise to brain and the spinal cord. So, infants' brain and the spinal cord will be damaged if they don't have enough choline. So, choline is very, very important. And the number one source of choline is liver, followed by egg. You get that also from bone marrow and brain. Okay, and also with milk and bruises and with germ. Improves memory. Choline is essential for proper fetal and infant brain development. It appears that choline affects the areas of the brain responsible for memory function and lifelong learning ability. To improve the IQ of your children so that they get 90 plus always, they need a lot of choline. Okay, so they need a lot of egg. That is from American Journal of Nutrition, 2004. Beneficial in the treatment of hepatitis. You know the job of choline? It converts into lecithin. As lecithin, it will remove all the clots in the blood vessel. Prevents stroke, prevents heart attack, prevents kidney failure, prevents fatty liver, and it can even dissolve gallstones. And it's also a good treatment for hepatitis. Okay. Beneficial the treatment of hepatitis. That is for the Tropical Gastroenterology Journal. Okay. Essential for the detoxification function of the liver. Without choline, the liver is helpless. It cannot remove the toxins in the body. Necessary for correct metabolism of cholesterol and prevents and dissolves gallstones and kidney stones by emulsifying their constituent lipids. Okay? Liver damage appears to be the result of increased liver cell death because cell culture studies have shown that liver cells initiate programmed cell death apoptosis when deprived of choline. When the liver cells are deprived of choline, they commit suicide. Where do you get choline? You get it easily from liver and by eating egg. If you don't like bone marrow or brain. Right? So very easy. Just eat eggs and you have enough choline. Okay. A recent study reported that the choline deficient diet induced DNA damage and apoptosis in peripheral lymphocytes. The white blood cells that will fight for you, they commit suicide without choline. And liver cells also commit suicide without choline. And I told you earlier, liver cells commit suicide when they're exposed to polyunsaturated fatty acid, corn oil, canola oil, soybean oil, but they are healthy when they're exposed to butter. Deficiency of choline is associated with an increased incidence of spontaneous liver cancer. Yun lang pala eh. So, to prevent liver cancer, you eat liver, you eat eggs. And increased sensitivity to carcinogenic chemicals. When you're exposed to pesticide, viruses, catol, you get cancer. You prevent that by increasing your choline intake. How choline deficiency promotes cancer? If you're deficient in choline, what will happen? It causes liver damage, and regenerating liver cells are more sensitive to the effect of carcinogenic chemicals. If you are exposed to pesticides, the liver cells are hopeless without choline. It results in decreased methylation of DNA, resulting in abnormal DNA repair. For the DNA to function, it has to be repaired, and the DNA needs methyl group. It comes from methionine or choline. Without methionine or choline, the DNA, you produce abnormal DNA, which is cancerous. results in increased oxidative stress in the liver, increasing the likelihood of DNA damage. So, lalong reactive oxygen species will increase in the liver, and the liver will do further damage. May stimulate changes in the programmed cell death of liver cells, contributing to the development of liver cancer. The normal liver cells will commit suicide, so cancer will come in. So, you will be protected by choline. Okay. That is modern nutrition in healthy disease. Increased intake of choline can reduce levels of circulating homocysteine. What is homocysteine? It is an amino acid linked to increased risk of heart disease. So it's best that you have a lot of choline. The author said that even if folate intake is low, homocysteine levels can be reduced by having an adequate intake of choline and betaine. Intervention studies using high-dose betaine or choline supplementation reported homocysteine reduction of up to 20%. Liver is the richest source of choline, followed by egg, grain, and red meat. That's from the American Journal of Clinical Nutrition 2005. Still on choline, 1-alkyl 2-acetyl glycerol 3-phosphocholine derived chemically from choline plasmalogens of beef heart has been shown to possess powerful anti-hypertensive activity and to be an important, extremely potent platelet activating factor. So, it is a superpower anti-hypertensive. So, eating eggs will lower blood pressure because acetylcholine also lowers blood pressure. So, the teaching that egg is bad, your blood pressure rise, no. It prevents heart attack, stroke, cancer, and everything. When deprived of choline, fatty liver or muscle damage is developed, and signs of organ dysfunction set in. If you don't like fatty liver, muscle damage, you need a lot of choline. I think my control is already hungry. No, what I said. A little back. Choline is a B vitamin that prevents fat deposition in the liver, encourages liver fatty acid metabolism, and increases subsequent oxidation. When paired with carnitine in medical trials, the two supplements fashion synergistic improvement in fat mobilization. Fat is literally flushed out of the body in the form of urinary acetylcarnitines. Okay, before I leave the discussion on choline, okay, a study was done, this published in the journal, on young animals. These are young cows. These young cows were fed complete food: fats, carbohydrates, vitamins, minerals. Fats, protein, carbohydrates, vitamins, minerals. So complete, right? They only removed choline. All the animals died in 7 days. So when they did an autopsy, the cause of death is glomerulonephritis. The kidneys are clogged. Kidney failure. Just in 7 days you will die if you don't have choline. That's how important choline is. The heart is also clogged, but not enough to kill. The brain is also clogged, but not enough to kill. Because choline as lecithin will unclog everything. So they repeated the experiment. Again, without choline. On the 6th day, the animals were dying already, very weak. They gave the animals 1,000 milligrams of choline. All of them survived. Question: where do you get 1,000 milligrams of choline? By eating plenty of liver, or at least eating 8 egg yolks a day. 8 egg yolks provide 1,000 milligrams of choline. And that totally reversed kidney failure. And yet, choline is also very important as lung surfactant. That it will open up your lungs. If you are deficient in choline, your lungs will not open. You are alive. The resistance is there. But as lungs surfactant, it lowers cardiac station, it opens up. Yes, COPD. That's why when COPD, they live long, up to 90s. In one, they live 100. They were 77 years old, and they live up to 94 years old. So you see, and they were dying at Makati Medical Center in 1977, but they are still much alive. Okay, so you see how choline, how diet works in opening up. And choline is very important for brain function. Without choline, ang labas nyo choline. When paired with carnitine in medical trials, choline and carnitine's function by synergistic improvements in fat mobilization. Fat is literally flushed out of the body in the form of urinary acetylcarnitine. So it's good for removing fats. Methionine. By the way, methionine is an essential amino acid that is also a methyl donor. As a methyl donor, you can use methionine as a methyl donor to produce antibodies, enzymes, hormones. And methionine is also a source of choline. Okay. Aging is associated with loss of methionine, sulfoxide reductase activities in the tissues, and decrease in the menstrual levels will lead to a decrease in the maximum lifespan. Whereas overexpression of leads to a dramatic increase in maximum lifespan. You like to prolong your lifespan, you eat foods rich in methionine. Where do you get that? Egg, okay? Beef, fish, dairy products, and other high-protein meat, may play an important role in regulating mood and in the treatment of depression. So, kailangan maalis ang utak, okay? May exert an important role in reversing hepatic glutathione depletion in patients with liver disease. The European Prospective Investigation into Cancer and Nutrition cohort study conducted from 1992 to 2000 revealed a dramatically lower risk for lung cancer among participants with the highest blood levels of vitamin B6 and methionine. So you see the role of methionine. Prevents bacteria from sticking to urinary tract cells, which may make it useful for preventing bladder infection. And evidence